Welcome back to our 2017 Educational Webinar Series. This month we have 5 complimentary webinars that will look at issues related to access in healthcare. I am Dr. Jill Brooks, Senior Director of Education for First Healthcare Compliance. At First Healthcare Compliance, we help you with a comprehensive compliance management solution tailored to your business, a hospital network, a healthcare practice of any size, a billing company, or skilled nursing facility. As part of our complimentary Educational Webinar Series, we bring you experts from around the country to discuss relevant topics in the healthcare industry. Today we have Jim Cucinato, CEO of Halo Health International. Jim started Halo Health International with Ellen Magenheim in 2010. Halo Health focuses on helping our friends and neighbors live healthier through the use of digital patient education platforms. These products broadcast customized ad-free advice in waiting, exam, and inpatient rooms, as well as lobbies or cafeterias. Jim has been a successful executive at Fortune 500 companies such as Newell Rubbermaid, Pfizer Consumer Products, and Tyco Toys, as well as mid-sized and startup companies such as Quickie Manufacturing. Jim has ample experience in leading sales, marketing, customer service, purchasing, and operations departments. He is known as an innovator, having won back-to-back Toy of the Year awards, as well as 2 first-place POPAI awards in his career. He understands the challenges of bringing concepts to market, as he has launched over 1,000 consumer products. Jim received his MBA from the Rutgers University School of Business and has a BS in Marketing from St. Joseph's University. A copy of the presentation is available for download in the control panel. Feel free to submit questions into the question box on your control panel. We will address questions at the end of the presentation. Jim will also be using some interactive polling questions during the presentation. We invite you to participate with these anonymous polling questions. Your Paycom CEU certificate will be emailed to you from Paycom following the broadcast. There is no need to request it. Additional CEU opportunities will also be available to BC Advantage members following the live broadcast. See their website for details. Jim?
Yes. Thank you, Dr. Brooks. I am very excited to talk to everybody today about a topic that really affects patient satisfaction, but it does it in a very soft way. We're going to talk a little bit about Dr. Google and how your practice can combat Dr. Google and put yourselves in a good position to gain more customer satisfaction through education, which is what Halo Health does. So the first thing that we want to talk about is who is Dr. Google. And for those of you that don't know, she is the most famous doctor on the planet, and that every one of your patients are consulting with her before they contact you. And the reason why is because she only performs house calls and she's open 24/7. She also has 2 partners in crime, Dr. Facebook and Dr. Twitter, and the 3 of them are very dangerous to your practice because they are giving out information and you have no voice, so to speak, to talk about how to combat that misinformation. The most important things about Dr. Google is that she does not charge her patients for her advice, and her advice changes every time you search. If you think about it, when you are looking for answers on anything, every time you go Google it, the answers change. This is no different with looking for medical advice. The other thing that's really great about Dr. Google is that she never really tells you what's wrong with you, but she lets you guessing, so that when the patient finally decides to come see you, she's basically telling you, what's wrong with her, even though, really they don't have any idea. And the other thing that's interesting about Dr. Google is that the patients are not coming to see you because they trust everything that they're reading on the internet as gospel. And obviously that's dangerous too. You shouldn't believe everything on the internet. Rumor has it it's not all true. So what can you do to stop Dr. Google? Well, one of the things that you need to do is you need to look at your practice and try to figure out how you could turn it into a learning and service center. And the ways that we believe that this happens is if you look to improve your website, if you master social media, you need to embrace telehealth, you need to utilize personalized email. Lots of practices are using email. There are just more effective ways to do that. And then the final thing is to kind of turn your practice into an education center, and we'll talk to you about how to do that. Before we get too much further, though, we want to ask you a quick question about your offices, and we want to know what type of platforms your office has now, what you're using in your practice. So please vote on that as we keep on going. Okay, so the first thing we're going to talk about is your website. And one of the most important things on your website is you need to tell your patients what you actually do. I can't tell you how many times we look at a website and it talks about everything except for the services that you provide and your specialty and the diseases you treat. And quite honestly, it's great you have your phone number, it's great you have your contact information, but one of the most important first things that you need to do is you need to tell them, who you are, what you do, and why they should care. One of the other innovative things that we've seen people put on there is we've seen them put information on how to decide whether they need to go to the emergency room or not. And that's actually really interesting because, that's one of the big things is, do I need to go to urgent care, do I need to go to the emergency room, or can I wait until tomorrow? And by having some type of test on your website to do that, you're providing your patients a great service. The other thing that you want to look about is talking to your web developer, and none of this stuff costs a lot of money, but you need to make your site a little bit easier to use. A lot of them, you try to cram as much information as you can on the front page, and that's great, but it's not necessarily user-friendly. So, talk to your web developer. If you're doing it by yourself, talk to somebody who's a professional that does this for a living, and they can really help you lay out the screen design of your website. You want to use hot buttons. Hot buttons are great because they enable you to jump from space to space. If you think of a retailer site, one of the hot buttons across all of them is store locator. Another one always talks about sales. Well, you want to use those in kind of the same type of thing. If it's flu season and you want people to schedule their flu shots, put that hot button on the front page of your website, have them push it, and jump right to the ability to schedule flu shots, because you're going to get more people to do that when it's a one-step operation than having to call the office and talk to somebody live. But most people who are surfing the internet really are trying to avoid having to talk to someone. The other thing is, if you're not telling everybody how great your practice is, nobody's going to do it. So you can't be humble on your website. This is the time to talk about how many awards you've won, how many people are seeing you. So you're serving thousands of people in the greater Philadelphia area. You want to talk about your staff, all of the awards and recognitions your staff has gotten. You really want to come out and brag. Lots of people look at this and they say, this isn't really for me. I really don't want to talk about myself. But my thing is, if you're not talking about yourself on your internet, on the website, why are you even having a website? Because if you're just going to put basically catalog type information on there, it's not interesting to the person who's looking at the other end, and then you're really selling yourself short. And then the other thing that they'll always say is, you don't have to spend a ton of money to make an effective website. It really is the content and the layout and all of the things that you put into it, not necessarily all of the backbone and things like that. So, if you ever have any questions about that, we'll be happy over here at Halo to talk to you about that. The second thing is, you need to master social media. Most people have access or used Facebook in a business environment, 57% on our poll that we just did, which is great. But you need to look at utilizing, what I call the big five, which is YouTube, Facebook, Twitter, Instagram, and Pinterest. And we'll jump in and talk about all of them now. But from a real high level, you do not have to be a power user. You just have to be familiar with how to use all of these, and it will definitely help your practice. The other thing is, it doesn't take a lot of time. when I do the social media for my company, it takes me about 25 minutes, and I'm able to schedule a week's worth of social media, for lack of a better term. So it doesn't have to take a lot of time. The first one we're going to talk about is YouTube. YouTube is great because it is a 100% visual medium. And one of the things that we've learned through our years in marketing is that people respond very well to video. And the other thing that we learned from working with YouTube is that you do not have to be a perfectionist. So a lot of times that hokey, folksy type video has a lot more appeal than a slick, high production value ad or commercial. So the key with that is to take some time. You can do it on your phone. You can do it with a digital camcorder, and go around and maybe interview your patients. Get a quick referral or testimonial from a patient on why they love coming to your practice, or how you treat a specific disease, and because of their adherence in your treatment, they were able to live a healthier life. It's also a lot of fun because it's a great team bonding experience. A lot of times we'll pass the camera literally around in our office and say, okay, talk for 30 seconds about, our company, what makes it great, what can we improve, and things like that. And people end up being hams, and we tell somebody to talk for 10 seconds, they end up talking for a minute. And it's a great way to build exposure to your practice. The other nice thing is YouTube is owned by Google. So anytime that you have information on YouTube, it bubbles up to the top of the Google searches. So when somebody comes in and they want to do a search on melanoma, if you are a dermatologist and you're spending a lot of time talking about melanomas on YouTube, you're going to bubble up to the top of that search, especially when they put geographic limits on it. So they want to learn about all the doctors who treat melanoma in Virginia, then that type of stuff really helps with your ratings and your SEO. The next site that we want to talk about is Facebook. And Facebook, it's very important that you create a fan page for your practice. So any person in your practice can create this fan page, but what that enables you to do is it enables you to put some controls on the actual Facebook page so that comments and things like that can either be cleared by you before they get posted onto the site, or you can have it blocked so that there's no two-way communication, just one-way communication out to your patients. But what it does is it enables you to kind of show off what you know and what you do in very fun ways. I mean, if you think about what you're doing in your personal Facebook, is you're keeping track on your friends and family and their activities and things like that. Well, you can do the same thing with your practice, but you can do things that kind of help you drive satisfaction. You could talk about events. You could talk about new services that you're offering. You can talk about your staff. You could talk about all of the different things that go on to determine if somebody has a disease, or how to live healthier. You can really talk to people about a recipe of the day. It's really an interactive medium, and it's also a great place for you to kind of speak to patients in a way that they're used to being spoken to, because they're all familiar with Messenger, and they can send you a message, and then you can have a conversation with them, kind of speaking their language. The other nice thing about Facebook is you can take all of your YouTube videos and you can post them, and you get a dual use out of all of the YouTube videos that you do. And again, the more activity that you're showing on social media, the easier it's going to be for your patients to find you. That being said, Twitter works in about the same way as Facebook, but much different in that it's very informal. It's quick sentences like, flu shots available, make your appointment. Don't forget that copays are due at the time of treatment. It's quick, communication that you want to get out there, and you want to kind of make top of line. Don't forget to schedule your kids' sports physicals, things like that. You also want to take the images and videos that you've created on your other platforms and get them out there through Twitter, because Twitter is great that just about every tweet has a link to it, and you can then have them link back to Facebook, have them link back to YouTube or your website, and you're kind of getting people to almost force-feeding them to read the information that you have out there. It's a very, very useful tool. Instagram is another one, especially for your younger patients. Instagram, Snapchat, anything that they're great. They post a picture, they have a quick caption. It's great for pictures of healthy breakfasts or quick exercises and things like that, so that someone can be going through Instagram, look at it, and say, "Oh, that's a really cool recipe," and then you either have the recipe embedded in Instagram, or you can have them come and visit you on Facebook or somewhere else to actually get the actual recipe. But it's a really good medium because it's visual. Pictures say 1,000 words. Instagram does a great job of getting that out in front of your patients, and it's a tool that you need to be good at if you're going to do social media. As with Pinterest, Pinterest is great because Pinterest is kind of the place that mom goes, and as everybody knows, mom makes the decisions in most families, especially with healthcare. And if you want to get your message out there about living a healthy lifestyle and how you can help your friends, neighbors, and family live healthier, this is a great place to find mom to do that. So that's a quick overview on social media, and we're going to move into talking a little bit about telehealth. Again, if you want to combat Dr. Google, you want to give the illusion that you're open 24/7 just like they are. And there are tons of people and programs you could partner with for telehealth that enable you to do that. We know that a lot of the practices don't want to get involved with telehealth because they don't want to be on call all the time. But there are ways you can outsource those types of calls to different companies, and they act as you. There are people that you can partner with so that you're working with a kind of a non-competitive office. And then obviously if you're a part of a health system, a lot of health systems, they're beginning a lot of telehealth departments, and they're trying to take that burden off the individual office. But one of the reasons why a patient is relying on Google is that they can't talk to somebody live. Embracing telehealth and making it an important part of your practice is going to reduce the number of people that are going to be looking elsewhere for help. The next thing is interesting because we're going to talk about personalizing communications, and the interesting thing about that is that I expected that the answer to this poll, to be really high. Do you send correspondence to your patients? And I'll bet you that it's going to be probably in the high 80s when we're finished with the poll. But the question is, are you sending effective personalized communications? Sending birthday cards and appointment reminders, newsletters, that's great because it keeps you top of mind, but it's not really talking to your patient on a one-on-one level. And you can do that talking on a one-on-one level even though you're sending out broadcast emails. The example that I use here on the slide talks about sending emails to your diabetic patients and talking about tips and recipes and exercises. Well, if you're treating 50 people, you only have to write one email and it goes out to 50 people, but all of those 50 people know that you're speaking directly to them. And that's the key, is that you're going to get, if you want to build satisfaction, you want to build loyalty, and you want to increase your outcomes, then you want to make sure that you are you're talking to your patients at the time of need, but you also want to talk to the patients directly about their need, and that's very important. The other thing is that in the old days, we'll say in the olden days, you know, many practices would make phone calls after the patient went and saw the doctor just to make sure that they understood what was told to them. And that's one of the practices that really has gone away over the years, but it's such an important thing. If you have just, you know, taught a diabetic how to use, you know, their insulin, you know, the chances are when they get back to do it for the first time, they're not going to remember. That phone call, not only does it, you know, show that you care, but it's also going to help with compliance and adherence, because now that patient is going to be walked through any questions that they either didn't remember when you were asking them or that they had forgotten by the time they got home. So it's really, really important. The other thing is, I know everybody is pushing people to go to the portal, but if you can send a recap of an appointment to your patient, that is great, because that physical homework that they're given is in their hands. They're going to read it on the ride home. They're going to read it when they get home, and that's going to spur more communication. And more personalized communication you can bring up with your patients, the more they're going to come to you first, and that's the goal, right? At the end of the day, the best way to combat Dr. Google is to take away their need to go anywhere else but to call you when they have questions. The other thing that we want to talk about here is that you don't want to make it feel like you're bombarding them. You know, that's one of the things that we talk to a lot of doctors and practices about, and they say, you know, we feel like we're bombarding our patients. And it's like, you know what, if you're sending good content, you're never sending too much stuff to your patients. If you're sending things specific to what they care about, then, you know, you're never wasting a communication. The problem or the worry of the waste of communication is if you're talking about maybe you're promoting an event and the event only affects 5% of the people who are in your practice, and you know, you're sending it to everybody over and over and over again. That may end up getting a little bit of fatigue, but by and large, never worry about that. You're not going to fatigue them at all. Improving your office experience. This one is probably the most important one, because the front line of your company, of your practice, are the people who are sitting in the front desk in the office, and if you can improve that experience in the waiting room, in the exam room, you're going to you know, improve patient satisfaction. There's literally thousands of studies out there that tell you how to do that. Our suggestion is to kind of look at your waiting room and say, okay, if I want my patients to be smarter, how am I going to do that? And my thing is that you should really invest in patient education right from the beginning. And digital patient education is great because it's being given to the patient in a way that they're used to seeing it, which is video. Let's face it, everybody tends to remember videos. They remember songs. They don't necessarily remember lines from a book or a novel or a magazine. So the more you can get patients to think about what they're doing by visually seeing it, the better. Videos about how to eat when you have diabetes, what kind of exercise you should do, how your blood sugar, you know, works, and things like that, really help the patient when they're preparing to see you, so that when you talk to them about it, they have the ability to ask you questions that are going to spur better conversations. The other thing when we're talking about that is you want to talk about the positives, right? So when you look at talking to a patient and you know, you don't want to scare them into doing anything, because it's not going to work. What you really want to do is you want to talk to them in a very positive, feel-good way, and that's one of the things that digital media does. It's in your current your current patient education system, you're probably using a lot of what I would call flat materials. You're probably using a lot of brochures and things like that. And they tend to be written heavy-handedly, where videos tend to be shot because they want people to watch them. And using digital patient education really does help you do that. You want to talk about delivery methods. You can do anything from having an HDTV in a waiting room or an exam room to putting it on a tablet, to emailing the videos to them, to having little kiosks that are learning centers, anything that's going to help that patient learn. And we know that they learn in different ways. So, a lot of practices that we work with actually use all three of those systems. And it's not super expensive. It really isn't. For the value that you get being able to talk to the patient during the downtime, it really works much better to look at this type of stuff. The other thing that's interesting about the digital patient education is it spurs conversations inside of your practice. So a lot of times you'll have people who will be watching the same show, and they'll start talking about, say, the value of blueberries and how it's a superfood. And the next thing you know, 2 or 3 or 4 other people are all talking about blueberries and their blueberry pie recipe, and it really builds a sense of community. And again, when you're trying to improve your office experience, having that community feel is super, super important. So the big question, right, for you guys is, well, why do I even invest in these things? And the answer is quite simple. That if you can be a bigger resource to your patients are going to appreciate that, and you're going to get higher patient satisfaction surveys. The happier the patient is with the service that their doctor or their health system provides, the higher the patient satisfaction survey that comes back in. It's intuitive, and it bears out statistically all the time. And these are really inexpensive ways and simple ways for you to do that reinvestment, where you're not going through and adding an EMR system, or you're going out and you're having your patients polled and things like that. These are just things that a normal course business you should be able to do. And the big question, right, is well, how's that going to happen, right? It's great that you tell me all this, but how's it going to happen? And this is where you focus on more, better, greater, right? So you're going to have more productive appointments, because a smarter and more engaged patient is going to have better conversations. They're going to know what services that you perform. They're going to know how you do it, what your treatment philosophy is, and kind of the why they should care. It's also important, too, because if you think about it from a navigation standpoint, if they know that a health system has MRI and X-ray capabilities inside of their orthopedist office, that's a great convenience, and it's a great selling point. And the only way they're going to know that really is if you tell them, especially in multi-service and multi-specialty buildings. It's really hard for your patients to know everything's going on in that building. And if you're not taking the time to explain that to them, you're losing an opportunity to keep a patient inside your network so you can treat them better, but also to have them understand what you're doing and how you can help them live healthier. The quality of your conversation and the productive appointments, they go hand in hand. And then obviously the greater satisfaction, the greater breadth of knowledge of how to follow a treatment plan is going to yield better outcomes. Yielding better outcomes usually is because people have complied. Again, it all works hand in hand, and again, it's logical. I don't have to spend too much time talking to you about that. And the other thing that's kind of interesting is that you get a lot of byproducts from this, and one of them is more patient referrals. And this is interesting because you're getting a lot more referrals from inside of the same family. So if the wife is seeing the doctor and she understands all of the services that the doctor provides, her husband or children may also now be part of that group, and come in and start talking to them. And they'll also talk to their friends, and obviously the referral network grows. You get higher new patient inquiries. The higher you score in your SEO, the more people are going to find you. So it's great if you're the only doctor in a small town, but if you have, or in a competitive market, the easier it is for somebody to find you, the more new patient inquiries you're going to get. And the return on investment is really strong with something like this. We say you're going to see returns 5 times greater investment, but we see most people have returns between 20 and 30 times investment, because what ends up happening is that the patients stay, and they stay with you for life, and they start coming to you with many more reasons and questions. And you talk about something like obesity, and suddenly they talk to you and they understand that you have an obesity program, and they're coming to see you now 20 times over the course of a year, because that's how obesity counseling works, and they wouldn't have known that you even offered it if you didn't tell them. So those are the important benefits. The material we went over pretty quickly. We know that you're doing this over most people's lunch hour, and we'll give you some time to eat and things like that. But call Halo. We can definitely help you. We are a digital patient education company that focuses on one thing. We want to help your practice grow, and we do it ad-free, and we do it customized. We know that each practice is unique, and we really don't want to cookie cutter anything. We work with you to get the solutions that you need to combat Dr. Google. This is how you can find us, and if anybody has any questions, please send them to us.
Thank you, Jim. We do have a couple of questions, and feel free to continue typing them in. One question: how tech savvy does my office need to be?
Actually, that's a great question, Dr. Brooks. Most offices don't need to be tech savvy at all. As long as you have access to the internet and you have a little bit of patience, we can teach you how to do everything on here. One of the things that you don't want to do is kind of go to your kids, because the way the kids use social media and technology is way different than the way professional marketing organizations do it. But you don't have to be techies. You don't have to be a bunch of 20-somethings walking around with your iPads to implement any of this.
Okay. For each website, such as Facebook, Twitter, Instagram, would the medical practices need to be careful of a potential HIPAA violation, and would there need to be a special form informing patients to prevent patient information violations?
Yes, that's actually a really good question as well. So HIPAA is very important. That's one of the things why, like on Facebook, you tend to turn comments off. They can connect with you, and they can message you, but they really can't leave information saying, I have this specific issue on your Facebook, on your general Facebook page. The other thing is that there are forms, and we can help you with that let them know that part of your care is communication through email and through Facebook and things like that. And if you don't want to receive email or something like that, to let us know. And it also says don't send personal information and all that fun stuff.
Okay. And how much time would it take to implement something like this?
So if you were going to do this yourself, it probably would take a person about 5 hours a week. If you work with somebody like Halo, it probably takes you about 1.5 hours of active work and about 45 minutes a month of inactive work, and it becomes kind of autopilot. Once a marketing company like Halo learns what you're looking to say and what you're looking to do, it takes very, very little interaction and time from the practice.
Great. What advice can you provide if a negative comment is posted on Google?
That's an interesting question, because it is really hard to scrub a negative comment. In fact, I've read some statistics that basically say that you need 10 positive comments to eliminate a negative. It depends on what the negative comment actually is. If it's a comment about a personal attack towards the doctor or the practice, there are companies that specialize in making those comments go away. If it's something that can be rectified in that, you know, I went to the doctor and you're 20 minutes late, I would reach out and talk to that person and see, you know, what the real issue was. And lots of times you'll actually see them put a retraction, or they'll post back that, you know, I originally had a problem with practice A, but after talking to them, it was a misunderstanding, and they're great people. But if it's really bad, there are companies that make all comments go away.
And last question, how do my patients benefit from something like this?
Well, your patients benefit from these interactions because they feel comfortable coming to you to begin with, and now they know that you are a great resource for them, and they have the ability that when they're doing their research to go to somebody that they trust first, that they know. One of the reasons why so many people will post their symptoms on Facebook or Twitter is because they want to get that interaction from somebody that they quote know and trust to respond to them. When they're going and then they have a sore throat or they have spots on their arm or something like that, being able to go to your website and have them be able to work through it and call and know whether they have a medical emergency or whether they just can wait until the next appointment day really does put them at ease. And it you know, anytime you can be their major resource, your patients are going to benefit.
Okay, and just a clarification question on the negative comments. What about those negative and false statements against a provider? Is there any way we could contact the website to retract the information, and does it need to have evidence?
That moves a little bit out of my expertise. Like I said, I do know that there are companies that are literally reputation defenders, and they would be better people to talk to about that. I know that there are software programs that can be attached, or, you know, kind of like add-ons to your website or to your Facebook that would, where on Facebook you actually can decide whether you want comments or not, but on your website to kind of scrub what goes on each site. One of the simple things to do, you know, like if it's a Foursquare or an account, or, you know, a site like that that's posting the negatives, I think if you do contact them, you know, they'll talk to you, but, you know, that's hard. I would go to the reputation defender route first.
Great. Well, thank you very much. Oh, wait.
Thank you. I really had a good time. I hope everybody out there learned something today.
I think there might be one more question. How do we create a fan page on Facebook?
That's actually pretty simple. If you go onto your main page, there's a button that says Add New Page, and when you add new page, it'll say Business or Fan Page, and you just click that, and then you just build your page from there. It's actually very simple.
Great. All right, well, that concludes the questions. And again, if anybody has any more questions, please reach out directly to Jim, or you can certainly send them to us and we will forward them on. Please join us again next week for another one of our educational webinars, January 24th at noon, The Power of Empathy for Conflict Prevention with Yvette Durazo from Unitive Consulting. You can register for this webinar and also request a demo of our compliance solution at our website, 1sthcc.com, or call us at 888-543-4778. Please use his contact information on the screen for any questions. If you send us questions, we will forward them on, and your Paycom CU certificate will be automatically emailed to you. You do not need to request it. Thank you very much, and have a great day. Thank you, Jim.
Thank you.